And I'd like to introduce Farzad again for coming up for some closing remarks.
Oops. I'm humbled by the work of these communities, these beacon communities, and I'm reminded by these cameras that I'm not just speaking to the beacons who are in the room today. We're also speaking to all the folks out there listening who might say, I'm doing that too. I should be talking about what I'm doing too. I deserve to be up on that stage too. And there are lots of folks out there who are doing amazing things. It's not just our 17 beacon communities. There's a whole nation of beacons out there who are doing this hard but rewarding work, who are implementing planned care and panel managers and working on care transitions and working on decision support and getting the data out in a format they can use it, reminders to patients, connections to patients at home, and population analytics. There's lots of people now who are tilling this field. And let me take a moment to reflect back some of what we've learned from our beacon communities, but also the things that I think not only our beacon communities, but the larger beacon nation out there might benefit from being reminded of these principles. We've heard from our beacons about the importance of governance. And, you know, a couple of years ago, if I'd heard that term, governance, I would have said, just one of those buzzwords doesn't mean anything. In fact, as we found with our beacon communities, governance is everything. If we don't have inclusive, transparent, open processes, if we don't truly engage the stakeholders, we can't do this. We can't succeed. And it's not just the healthcare providers, it's not just the big hospitals, though they're very important. It's not just the physician groups, though they're critically important. It's also our public health departments. It's also the state Medicaid departments, the federally qualified health centers, the consumer groups, the health plans. It's, for our programs, just a reminder, it's the regional extension centers, if you're not one already, are critical allies for you. It's the State Health Information Exchange grantees, it's the Community College Workforce Program, it's the SHARP program. These are resources that you should be connecting to, not just you, the 17 beacons, but you out there, all those of you who are laboring in these fields, and you need that connection, and you want to be engaged. So good governance. Eye on the prize. We heard over and over about having that specific focus that you can work backwards from. This is, you know, in a way, Atul Gawande in Better, which is one of the better books I've ever read, talking about pick something, measure it, and improve it. Having that specific goal that you can work backwards from, the eye on the prize. It's also the feet on the ground. What we've heard today is that from a year ago till now, these beacon communities, many of them have moved from, now some of them have been doing this for years, but not all. Some of these are newly formed collaboratives, newly formed activities, have moved from planning and design to really feet on the ground, really in the doctor's offices, in the hospitals, working with patients, working with home care, working with plans in a very grounded, real way. And with that, with the exhilaration of doing real work comes real failures. Not everything we do is going to work. We know that. And what's important is that we learn from those failures, that we talk about those failures, that we fail forward, that we fail once, not the same way over and over and over again. So we need to hear from you and from Beacon Nation about not just the things that worked, but about the things that didn't work. And we need to be not dug into saying, this is our implementation plan, and by golly, no matter what happens, we're going to have to, plan B is to make plan A work. We have to be monitoring our strategies and saying at some point, not early on, because implementation's hard. We're not going to quit when the going gets tough. But at some point, we've got to be open to recognizing, is this just an implementation problem, or is this a strategy problem? And we got to be keeping some powder dry to be able to learn and pivot and shift strategies and learn what someone else has done that's really working and steal that. That's a good thing. So feet on the ground. Fostering innovation and engaging the market are key principles for us. These are not government projects. We in government can't do this. This all has to be in collaboration with the energy and enthusiasm and innovation that comes with a free market system. And we need to engage the private sector, the private payers that are going to be critical to sustainability, and the private innovators. You heard Anish talk about, bring your problems to the tech innovators. Bring those who are willing to take a gamble with innovation and delivery reform, and let's match you up with folks who want to solve the problems that you have posed. But in doing this, we have a special obligation to make sure that the work we do is truly open to all. Open to all. That means rural areas. Nearly all of our Beacon communities involve extending the work to the rural areas, to the inner cities, to underserved communities. We have to make sure that whatever we do isn't just for keeping the organizations that are further ahead even further ahead. That's not what this is about. This is about spreading that goodness and engaging and truly being open to all. And finally, we heard about putting the patients, the public, individuals in the center of everything we do, putting their interests in the center of everything we do, including their privacy and security, which we didn't hear much about today. But it's critically important. We can't do this unless we maintain the public's trust in these information systems. Information needs to be where it needs to go to help the patient's care, but it also needs to be private and secure. And we can never compromise on that. We heard about patient-centeredness in our design, patient engagement in our interventions, patient participation in governance. But the challenge I put to you is one other dimension of being patient-centered, individual-centered, putting the patient in the center, is putting the patient in the center of how we talk about what we're doing and helping your communities really understand what it is that you're doing. My dream is that if you went to anyone in your Beacon communities, whether it's in, Minnesota or Mississippi, whether it's Hawaii or Maine, that every member of that community, every teacher, every healthcare worker, every elected official would know what we're trying to accomplish and how we're trying to accomplish it, would feel that they're a part of this beacon. And I don't think we're there yet. I don't think our communities really understand and feel a part of the beacon activities. And I want us at ONC to be talking about health IT in a way that people can understand what it means for them. What does it mean for them? What does all this mean for them? So those are the principles, and in each of one of them is guidance, but I also think a challenge for us in moving forward. But what I do know is that in you here, the 17 beacons, and also you out there in the Beacon Nation, we have the best partners we could possibly hope for in moving this, this great challenge forward. And I want to thank you for the hard work you do every day.
Thanks very much, Farzad. I want to just close by thanking the Office of the National Coordinator for their assistance in putting together this meeting and obviously all of their work on supporting the Beacon program. Thank the Milbank Foundation for their support for this meeting. And then a special thanks to the Brookings staff that helped put all this together. And a very special thanks to all of the Beacon sites that are doing all this hard work, to all of you who are helping and helping to move it along and to provide additional momentum for it. This real work of healthcare reform is very hard work, but we are seeing some jazz ensembles now, and while there is work in progress, looking forward to a lot more music and maybe some symphonies to come. Thank you all very much.